You felt it. Sitting down, wiping after using the bathroom, or just shifting in your chair, and suddenly there it is, a lump, right there at your anus. Something that absolutely was not there yesterday. And in the span of about 10 seconds, your brain has already run through every worst-case scenario it can invent. Is this cancer? Is this something serious? Do I need surgery? Why does it hurt this much? And why now? Take a breath. In the next few minutes, you're going to get 3 things. You're going to learn what that lump most likely is, because there are only a handful of real possibilities. You're going to get a clear step-by-step plan you can start within the next hour to bring the pain and swelling down. And you're going to learn the specific warning signs that mean stop everything and get seen in person today. Let's get into it. Here's the honest truth about what you're dealing with. In the vast majority of cases, a sudden painful lump at the anus is something benign, something that responds beautifully to simple care you can do at home within a few days, with no procedures and no drama. That's the good news, and it applies to most people watching this right now. But there's a second truth that matters just as much. A small percentage of lumps that feel and look exactly like the common ones are actually something more serious underneath, something that needs hands-on examination, sometimes within hours, not days. And the tricky part is that from the outside, sitting on your couch, you genuinely cannot tell the difference with certainty. So here's the principle to hold on to. Home care is reasonable for the first 48 hours when symptoms match the common pattern. But if anything escalates, if anything feels off, or if you simply don't improve, you get examined. Not next week, that day. Keep that rule in your back pocket as we go through everything else. Let's start with the 3 causes that account for the overwhelming majority of painful anal lumps. If you understand these, you understand what's most likely happening to you right now. The first and most common is an inflamed external hemorrhoid. Hemorrhoids are actually normal cushions of blood vessels that everyone has, yes everyone, at the opening of the anus. They become a problem when those vessels swell and get irritated. When that happens on the outside, you get a tender, puffy lump that you can feel with your finger. It can sting, throb, or burn, especially when you sit down or pass stool. The second is an anal hematoma, which you'll also hear called a thrombosed external hemorrhoid. This is when one of those external blood vessels actually ruptures and a small blood clot forms right under the skin. The result is a firm, dark, marble-like lump that shows up suddenly, often overnight, and throbs intensely. The pain peaks in the first 48 to 72 hours and then slowly fades. The third is a skin tag from a current or past anal fissure. A fissure is a small tear in the lining of the anal canal, and the body sometimes leaves behind a little flap of skin at the edge. Most of the time that tag is painless and you barely notice it, but it can flare up, swell, and suddenly feel like a brand new lump. And here's the myth worth busting. Hemorrhoids themselves do not normally hurt. They itch, they prolapse, they sometimes bleed a little after a bowel movement, but pain, real sharp pain, only shows up when they get inflamed or when a clot forms. That distinction matters. Now for the part that most videos on this topic skip entirely, because while the 3 causes you just heard cover most cases, there are a few less common conditions that can look almost identical from the outside, and these are the ones you absolutely do not want to mistreat at home. The first is a perianal abscess. This is a pocket of pus that forms in the tissue around the anus, usually from a small infected gland. It feels like a hot, hard, throbbing lump, often with a deep ache that gets worse hour by hour. You may run a fever. You may feel generally unwell. An abscess will not resolve with sitz baths and ointments. It needs to be drained, and the longer it sits, the higher the risk of the infection spreading into surrounding tissue or into the bloodstream. The second is prolapsed tissue from inside, either a small polyp or a piece of the rectal lining that pushed out during a bowel movement and got trapped by the sphincter muscle squeezing shut behind it. From the outside, it can look exactly like a swollen hemorrhoid, but trapped tissue can lose its blood supply, and that's a true emergency. The third is an inflamed anal papilla, which is a small internal structure that sometimes prolapses and swells. Picture someone walking into urgent care convinced they have a hemorrhoid, and the exam reveals one of these instead. It happens more often than you'd think. That's why the 48-hour rule matters so much. Now let's talk about what actually works. The first and most important step in the protocol is also the simplest, the cheapest, and the one most people get wrong: the sitz bath. A sitz bath means sitting with your bottom fully submerged in a basin of hot water. That's it. But pay attention to the details, because the details are where the results live. First, let's kill a myth. A sitz bath is not steam. It is not vapor. It is not standing over a pot of hot water hoping the heat reaches your skin. None of that works. You need direct immersion. Your anus needs to be sitting in the water, not above it. Second, the temperature. Lukewarm water will do almost nothing for you. The water needs to be genuinely hot, not scalding, not burning, but hot enough that it would feel intense if you stepped into that shower on a cold winter morning. That heat is what relaxes the sphincter muscle, opens up local circulation, and pulls the inflammation down. Third, the duration. 15 minutes per session, minimum. Set a timer. Keep a thermos of hot water next to you, because after about 3 minutes the water in your basin will start to cool, and you'll need to top it off to keep the temperature where it needs to be. Fourth, the frequency. 3 times a day is the baseline: morning, afternoon, and evening. If your pain is severe, push that to 4 or 5 sessions a day. Keep doing it for at least 7 days, even after the pain starts to improve. This is the foundation everything else builds on. The second piece of the protocol is a category of medication called phlebotomics, also known as venotonics. The name sounds complicated, but the idea is simple. These are pills that strengthen the walls of small blood vessels, improve circulation in inflamed tissue, and pull down local swelling from the inside. They work hand in hand with the sitz baths. The combination that has the most evidence behind it for this exact problem is diosmin plus hesperidin. Specifically, 900 milligrams of diosmin combined with 100 milligrams of hesperidin, which adds up to 1,000 milligrams per dose. In many countries, this combination is sold over the counter under various brand names. In the United States, you'll usually find it as a supplement at pharmacies or online, often labeled as a vein support or hemorrhoid relief formula. Check the active ingredients on the label to make sure you're getting the right combination. The dosing pattern matters as much as the medication itself. For the first 5 days, take 1,000 milligrams every 8 hours. That's the loading phase, when symptoms are at their worst. From day 6 through day 10, drop to 1,000 milligrams every 12 hours. Then from day 11 through day 30, take 1,000 milligrams once a day as maintenance. That full 30-day taper helps prevent the swelling from bouncing back the moment you stop. Realistic expectation here. Most people feel a noticeable drop in pain and swelling within the first 48 hours of starting this combination alongside the sitz baths. The third piece of the protocol is a topical ointment applied to the lump itself. There are dozens of options on pharmacy shelves, and you may have stared at that section feeling completely lost. Here's what actually matters. Most ointments designed for this problem contain some combination of 3 things: a low-dose corticosteroid to bring inflammation down, a topical anesthetic, often lidocaine, to numb the area and break the pain cycle, and sometimes bismuth or zinc-based compounds that act as protective astringents on irritated skin. The honest truth is that no single ointment in this category is dramatically better than the others. They're all aiming at the same effect. Pick one that contains those active ingredients and use it consistently. That matters more than the brand on the box. Now, application. This is where most people sabotage their own results. After every sitz bath, pat the area completely dry with a soft towel. Pat, never rub, because rubbing on inflamed tissue makes everything worse. Then put a small amount of the ointment on a clean fingertip. Do not use the plastic applicator that comes in the box. An applicator is designed for internal use, and pushing it against an already inflamed external lump will hurt and may worsen the swelling. With your finger, gently massage the ointment into the lump for 10 to 15 seconds. Don't just dab it on, work it in. The fourth and final piece of the protocol is a short course of oral anti-inflammatory medication. We're talking about NSAIDs, ibuprofen, naproxen, and similar drugs you can buy over the counter. A 6 to 10-day course at standard doses can dramatically cut pain and accelerate the drop in swelling, especially in the first 72 hours when things are at their worst. But, and this is important, not everyone can take these. Skip this step if any of the following apply to you. You have a history of stomach ulcers or significant acid reflux. You have any kidney disease or reduced kidney function. You've had bariatric surgery like a gastric bypass or sleeve. You're on blood thinners. You're pregnant, or you're already taking another anti-inflammatory or steroid for a different condition. If any of those describe you, talk to a clinician before adding NSAIDs to the mix. For everyone else, think of this step as the booster, not the foundation. The sitz baths and the venotonic pills are doing the heavy lifting. The anti-inflammatories just speed up the curve. Let's talk about what recovery actually looks like, because realistic expectations are half the battle here. When the lump is one of the common causes, an inflamed external hemorrhoid, a small anal hematoma, or an irritated skin tag, roughly 8 out of 10 people who follow this protocol consistently feel a meaningful drop in pain within the first 2 to 3 days. That's the realistic benchmark to hold yourself to. The pain comes down first. The lump itself takes longer. Most external swelling shrinks substantially over 1 to 3 weeks, and sometimes a small, painless skin tag remains behind after everything else heals. That's completely normal and not something you need to do anything about. If, after 48 hours of doing all of this correctly, your pain is the same or worse instead of clearly better, that is your signal. The protocol has told you something. Time to get examined. Now, before we get into the warning signs, I want to pause on something most people miss when they're dealing with a lump like this, because here's the uncomfortable truth. The lump is the symptom. It is not the root cause. What actually drives most of these painful flare-ups, the hemorrhoids, the hematomas, the fissures, the skin tags, is what's happening upstream, inside your gut. Sluggish digestion, hard, dry stools, straining on the toilet, bloating that won't quit, a bowel that simply isn't emptying the way it should. As long as that is going on, you can treat the lump perfectly, and another one will show up 6 months from now, sometimes sooner. And here's what surprised me. There's a strange little discovery, an 8,000-year-old underwater gut superfood that more than 3 billion people have already been using, that targets the exact root cause. Just one small pinch of it before a meal, and your body starts clearing out the toxic buildup that's been clogging your intestines. People are reporting they're emptying their bowels twice as fast, feeling lighter within days, and finally getting that comfortable, regular digestion back without restrictive diets, without expensive probiotics, without medications. The most counterintuitive part? It works even when you eat almost no fiber at all, which sounds impossible, but the science behind it actually explains why. If you want to see exactly how it works and why it's spreading so fast, point your phone's camera at the QR code on the screen right now. It'll take you straight to the full breakdown. I've also pinned the link in the comments below this video, so if you're watching on a TV or you can't grab the QR code in time, just check the pinned comment. Take a minute, watch it, and then come back here, because the next section is the most important one in this whole video, and I don't want you to miss it. This is the section to actually pay attention to, even if you skim everything else. These are the signals that mean the home protocol is no longer the right answer, and you need to be seen in person today. Urgent care, the emergency room, or a specialist if you can get in fast. A fever, chills, or feeling generally unwell, weak, or feverish. That combination with an anal lump, points strongly toward infection or abscess, and infection in this area can spread quickly. Pain that is getting worse instead of better after 48 hours of consistent treatment. Significant bleeding, not light streaks on toilet paper, but actual blood pooling, dripping, or soaking through. Inability to pass urine or stool, or severe pain that prevents you from sitting at all. The lump turning dark purple, black, or feeling cold and numb to the touch. That can mean tissue is losing its blood supply. Redness, hardness, or warmth spreading outward from the lump into the surrounding skin. Any sense that something is genuinely wrong beyond local pain, lightheadedness, racing heart, confusion. Most people watching this will not see any of these signs, but if you do not wait. Here's what to walk away with. A sudden painful lump at the anus is frightening, but in the great majority of cases, it is something benign that responds quickly to simple, consistent care. Hot sitz baths 3 to 5 times a day. A 30-day course of diosmin and hesperidin. A topical ointment applied properly with a fingertip after each bath. And, when appropriate, a short course of anti-inflammatories to take the edge off. Give the protocol 48 hours. If you're clearly improving, keep going. If you're not, or if any of the warning signs show up at any point, get examined in person. That's the whole rule. Take care of yourself, be patient with your body, and trust the process.